Hello and welcome to the Oxford Health Green Alert presentation. My name is John Upham and I am the Sustainability Manager for the Trust. To give you some background and context, climate change poses a major threat to our health as well as our planet. The environment is changing, which is having direct and immediate consequences to healthcare outcomes for patients and the wider community. In order to address the healthcare consequences of air pollution and climate change, the NHS has launched the For a Greener NHS programme, working with all staff, hospitals and healthcare partners. The Greener NHS programme will build on the work by trusts across the country and how to reduce the impact on public health and the environment, save money and eventually go net carbon zero. A panel of the world's leading experts are now reviewing all the evidence from trusts in order to set an ambitious route map and date for the NHS to reach net zero. The NHS and education sectors are the largest contributors to carbon emissions within the public sector. The NHS in England alone is responsible for around 20 million tonnes of carbon dioxide emissions annually. And this is split between the following areas. 59% of the carbon emissions are linked to procured goods. 13% relate to travel. 3% relates to commissioned healthcare, with a balance of 25% relating to energy, waste and water. And you can see on the right hand side where the split between the clinical impact on emissions and the estate's impact on emissions. The Trust's Green Plan is a board approved current life document which outlines the Trust's aims, objectives for sustainable development. Developing the Green Plan will assist the Trust to deliver on the NHS long-term plan to reduce carbon emissions and air pollution, improve the health of the local community, meet Climate Change Act legal requirements. The main aims of the Green Plan are to reduce carbon, waste and water, improve air quality and reduce single-use plastics. The Oxford Health Travel Plan links into the Green Plan. In terms of context, NHS accounts for 5% of overall road traffic in England, and travel is responsible for 18% of the NHS carbon footprint. A recent report estimated that 220,000 vehicle miles are driven around Oxford, emitting around 50 tonnes of CO2, all contribute to poor levels of air pollution and healthcare outcomes. The Oxford Travel Plan is a key part of this Trust commitment to sustainability and the long-term Green Plan. The OTP is the first step in completing Trust-wide travel plan. The key drivers for the travel plan are to reduce carbon emissions and air pollution, improve healthcare outcomes with active travel, and also meet the requirements of the Oxford City Council Zero Emission Zone. The travel plan sets out to promote active travel methods in terms of cycling and walking, how to reduce staff-related commute and business vehicle emissions, look at opportunities to reduce the number of single occupancy car use, review the pool car fleet and look at how this can be better utilised, and finally to undertake an annual travel survey to get staff feedback. In terms of targets, sustainability and carbon reduction targets are set out in the NHS long-term plan, specifically the commitment to the carbon targets in the UK Government Climate Change Act in reducing carbon emissions by 34% by 2020, 51% by 2025, and looking at net zero by 2050. In order to contribute to the overall carbon emission targets, the NHS long-term plan also looks at a 20% reduction in business mileage by 2023, which in real terms for the Trust relates to over 1 million miles. In order to contribute to overall reducing carbon emissions, there are a number of initiatives that can be adopted. We've decided initially on 5, which capture both travel and building environmental emissions. Number 1 was, where possible, try cycling to work or use public transport. And this also has the added benefit of physical health in terms of active travel. Number 2, again, on the travel side, was avoid travel where possible and use technology, which has been key during the COVID pandemic crisis. Number 3 was look at overall levels of waste reduction, look at recycling, print less and use less paper. Number 4, turn the heating down when you can. 1 degree means 10% saving on consumption and energy costs, which is a huge potential for the future. And finally, number 5 was turn lights off when not needed and use the benefits of natural light where possible. Thank you for your time and have a good day.